The following segment is sponsored by Stubbs Dental. If you've been told you don't qualify for dental implants in the past, there's new hope with Zygomatic implants. Dr. Kirk Johnson is here to tell us all about these new implants. Kirk, great to see you.
Good to be here.
We love having you here. Okay, let's start with the basics. What are Zygomatic implants?
Zygomatic dental implants are basically an implant that we use when people don't have enough bone for a traditional implant. The zygoma is a bone that actually is your cheekbone.
Oh, interesting.
So these implants are unique in that they're quite a bit longer than the usual implant, but it's an ideal treatment for patients that don't have enough bone for a traditional implant.
Sure. Okay, and how are they different from regular dental implants? Because I know you said dental implants came about 1980s-ish, early 80s?
Yeah, mid-80s, yeah.
How are they different from traditional ones?
So these were developed, like I say, for patients that didn't meet criteria for a traditional dental implant. A traditional dental implant can anchor a denture, it can anchor a crown or an individual tooth. The zygomatics are used for patients that are essentially dentulous and don't have any teeth at all, and don't have enough bone for traditional implants.
Well, look at these before and afters. It really is life-changing. What's the downtime like after this implant?
So usually we'll place a dental implant in the anterior maxilla on each side, so just right here in the front. The zygomatics will be one in each of the cheekbone that come down and enter. Yep, and enter. They're all underneath the gums and everything, but they enter right where they need to hold that denture in place. We'll anchor that initial screwed-in retained prosthesis, essentially a bridge, for about 6 months. And that's something that they can walk out immediately. It's not going to fall out of their mouth. It's going to look normal. And then 6 months later, we convert it to a final prosthesis, which is more of a stronger type of prosthesis after those implants have healed.
Sure. Well, and when you're not wanting to smile, and it really is life-changing to see somebody's smile before and after. I remember I had some veneers done in high school, and I never wanted to smile, and I was so scared to eat and everything. It changes people's lives. Yeah,
it does, absolutely. And for these patients, imagine not being able to have any teeth because you have no support to hold in even a denture.
Yeah.
These patients are far beyond even, you can relate, but they're not able to function, let alone smile.
Right.
Just because there's no support for a traditional denture.
Well, it's great to have this option. You have a special offer for our viewers too. Tell us all about it.
Yeah, we do. We'll bring a patient in free of charge for a consultation. As all of the scans, the CAT scan that we do to work up a patient for this kind of treatment, and we can visit with them, spend as much time as they need to educate, answer their questions, help them to understand how it works and how they can benefit from it.
Well, what a great option to have. And we want more information. Doctor, where can we go?
Well, we have a website. It's stubbsdental.com. You can get a lot of information there. We have several different locations. Hopefully it would be convenient for any of these people in this area to be able to come in and visit with us.
Definitely. Thank you for joining us today and giving us all this wonderful information. Great to see you.
Absolutely. Thank you. Thanks for having me.